As we look at some of the concerns, otherwise, we can look at what I've highlighted here in red. There's no significant medical liability charge in the bill. There's some pilot programs. State of Louisiana, for example, it's not applicable to the state of Louisiana, but it's imperative. And I dare say in Washington, D.C., I was just told the other day at our annual meeting that there's perhaps one African American in private practice practicing in the city of Washington, D.C., because the malpractice insurance, OBGYN, is so high. And if you look at this, how in the world can someone pay $10,000, $20,000 a month? How many babies can you deliver? How many surgeries can you do? It's impossible to do. So clearly something has to be done in regards to tort reform. And it's imperative that it happens. For example, in the bill it talks about seeing more, that you'll have access to more patients. Well, the problem is, particularly for those surgical specialties like myself and others, the more patients you treat or see, the more apt you are to have complications, even in spite of the fact that you may do perfect surgery. So that increases your risk. So it's really more about presenting quality care, but there has to be some kind of happy medium as it refers to us being able to treat patients and not being able to do so many things to the patients to cover yourself. And that's what's happening. There's so much money being spent, wasted, to protect yourself in lieu of being able to take care of the patient. And that's because of this problem that we have here. Additionally, physicians have to get paid for what they do. I mean, they're not looking to make a mint off of anyone, but it's certainly the case that you have to get paid to sustain yourself. You have to be able to take care of your practice and pay your bills. And if you can't, then you're not a happy camper, and you're not going to be able to be that happy with the patients that you're taking care of. And many of them are leaving practice. They're not. So if we talk about 32 million people, and you talk about doctors in their 50s or even younger, are leaving medicine to do other things, because most of them are very talented, very smart, and they can do other things as opposed to practicing medicine. And further, as we look at this whole piece of physicians not being able to take care of themselves, you have to incorporate the fact that all the other expenses are going up, and the insurance, even private insurance, is actually lowering its fees to the physicians and even asking for monies back after taking care of patients a year later. So we have to kind of add that in. I think it's important that we identify the fact that physicians need to be taken care of, not to make a mint, not to do this or do that, but everyone's going up, and how in the world can you say a 21.2% decrease in payment? It's a non sequitur. It just doesn't follow. So just reasonable rates has got to be implemented or put into the bill. Physicians have their insurance they have to deal with, and they also have student loans. The average medical student, they have $250,000 worth of bills and loans they have to pay. So how do you pay that? In regards to the U.S., the U.S. has the best medical system in the world. The U.S. also has the worst health care system among developed countries of the world. And they call it poor health for a reason. And I'm here to tell you, if you improve your wealth, in general, you improve your health. And our president, our vice president, or former vice president, just as an example, unfortunately, he has some serious illnesses. And I submit to you that if our former vice president was one of the least of these, he wouldn't be around today.
Amen.
So I'm saying it explicitly tells us how having money and resources increases your longevity and also makes the AARP quite happy. For most of man's history, per capita income has been the primary determinant of health and life expectancy, and is the major explanation for differences in health among nations and among groups within the nation. This is a biosocial model of racial stratification. If you, for example, look at socioeconomic inequality, and we incorporate racism and a number of other things, inadequate access to jobs and things of that nature. You have the education, you can't get the position because you're blessing of color. If we incorporate residential segregation. So what happens there? So residential segregation. So even if I want to eat healthy, even if I like to eat healthy, if I'm in an area, this segregated area, that has potato chips, popcorn for me to eat, no fruit, no vegetables, they have a significant number of fake fruit juices and sodas and other, I guess, liquid candy bars. What do you expect my weight to be? It's going to happen. Because I've got to eat. And don't ever go to a store, if you will, where you're hungry. You'll buy everything in sight. So it just tells you that we have to look at that as a factor as it relates to what we're going through in terms of our health status. So you got concentrated poverty and violence. Well, that creates stress, significant stress. And if you look at fight or flight, so if someone, for example, almost gets hit by a car, or someone's after someone else, or is on the verge of attacking someone, then your norepinephrine goes up, your epinephrine goes up, cortisol is released, and that flight or fight. But if, perchance, this is a daily problem for you, that you're concerned about this as a daily problem, then, of course, this all stays up. So you have a high allostatic load, or stress. And persistent stress causes cell damage. It also causes tissue damage, and it can lead to death. So that's something we have to interject. Now, if you incorporate some other health determinants, some other problems such as smoking and drug abuse and pollutants, then it makes it even worse. So these are some of the things we have to look at in regards to how we as a people, what's going on in our neighborhoods, what's going on with us in terms of our problems with health and being first in everything we should be last in, and last in everything we should be first. Those are some factors here. And I kind of highlighted the exposure to environmental pollutants. And in regards to everything else, you hear so much about black this, black that. It's always the lowest, always the worst, it's always this, always that. But it's not the genes, ladies and gentlemen. And I submit to you it's more of what we're talking about in terms of stress that we're going through. National Medical Association, health disparities, healthcare reform, workforce. These are the things that we're looking to do. Membership, mentorship, partnership. These are all things that I'm charged to do, and partnership is important. We intend to partner and collaborate with other major health organizations and organizations that are national, that in fact have health initiatives. So we intend to do that, so you'll be hearing more about that as we move along. What we're capturing here is the effects of the environment, which I kind of talked about, on minority health. The health of minority women and their families is another major concern of mine and the NMA. The state of health for African American physicians. So the effects of the environment on minority health, it's a major problem, and I said that to you. And if you say what's going on, things are not like they used to be, where did all the blue skies go? Poison is the wind that blows from the north and south and east. Oil wasted on the ocean and upon our seas. Fish full of mercury. Animals and birds who live by are dying. Things aren't what they used to be. Mercy, mercy, me. Does anyone know that? Mm-hmm. You know that? Mm-hmm. You're absolutely right. For those of you that understand or know that, he can sing it better than I can say it. Okay. All right, thank you. Mm-hmm. Next slide. What's going on? This is all the Gulf. Next slide. It's real. This is a refinery from Lake Charles, Louisiana to New Orleans, Louisiana. There's 125 refineries. This is in fact causing cancer. This is in fact causing reproductive problems, causing endometriosis. It's in the neighborhood, ladies and gentlemen, and this is part of the problem. This is in Shreveport, Louisiana, and it's right across the street from a 20,000 population neighborhood. And the kids all the kids are walking around with asthma problems and allergies and so forth. We've got to do something about this. Right across the street. Here's another problem as it relates to fishing. Those of you that do fish, don't eat the fish. It talks about here, if you eat more than 4 meals per month because of PCB, mercury, and so forth, then you got problems.